Today on CityCast Nashville, we're honoring Older Americans Month by focusing on how to support aging family members, friends, and loved ones. Joining me is our executive producer, Whitney Pasterek, to speak with Jess Quasi, Director of Care Management at 50 Forward, to share tips for navigating this difficult transition and to highlight the many ways Nashville offers support along the way. It's Tuesday, May 20th. I'm your host, Marie Cecile Anderson, and this is what Nashville's talking about. We're about to get into a pretty difficult conversation, I think. I just want to start. I did lose my dad last year to Alzheimer's, and navigating how to help was really hard. What I want to give our listeners today is really good information so we can help our aging parents or grandparents, friends. We just want to be able to give them tools and tips. So Jess, where in your opinion is the best place to start?
First, just being easy on yourself and grounded as best you can, because often it's our first time to go through something like that. And, you really can't prepare except for to go through it and then find some support. Here in Nashville and Davidson County, Williamson a little bit, we support people during that journey, whether it is just pre-retirement and just wanting to create community all the way till end of life planning.
I just want to state for the record that whoever helped my parents with their planning referred to end of life as end of retirement. Oh. So we prefer to call it when you reach the end of retirement.
Oh, that's a beautiful way of putting it. Mm-hmm.
Hilarious euphemism that now we all chuckle about as their end of retirement grows nearer.
I think having a good sense of humor around it, too, is absolutely necessary for caregivers. This is what I'm dealing with my uncle right now who lives in Georgia. He really wants to age in place, but unfortunately, his house is in total disarray. What should people be thinking about in terms of retrofitting their relatives' houses so they can keep living there as they lose mobility or even memory?
The big thing I would say is keeping that sense of normalcy and not moving things around too much, because as the dementia, as those symptoms increase, it can be really confusing if just one day you've decluttered to the point of whose house even is this? And then getting those accommodations in the house is what we want to do. Also, making sure that the shower is a walk-in shower, and that there's handrails, and that there's a ADA toilet that's tall enough to where, it's easier to get up and down.
Absolutely. Widening doors is something that we recently had to do at my mom's house so that walkers and then eventually someday perhaps a wheelchair can fit through.
Absolutely.
I'm actually working with a nonprofit in Georgia called House Proud, and they're going in and renovating, thankfully, to grants. It's free to my uncle. But I am curious, are there any other local resources for folks who don't have a ton of money?
There are. Nashville really is working to protect and keep safe, our older adults here. And so we tend to work with Westminster Home Connection. That's our big partner, and we're in lockstep every step of the way. But there's also other ones who we've referred to. There is Rebuilding Nashville, the Housing Fund, Home Uplift, United Cerebral Palsy, several different organizations.
And it might not even be ADA compliance or grab bars or anything that they need. It might be something as simple as gutters getting fixed. Do those companies also do basic repairs?
Yes, they do. The focus is safety and functionality. I've seen them change out outlets all the way to making flatter the threshold in a door so that a wheelchair can go over, just to give the best chance to the people to have a safe home.
Well, I've just gone through the process of moving one parent into senior living, and I learned a lot. Let's just put it that way. First of all, Jess, can you explain the difference between senior living, assisted living, memory care, a nursing home, hospice? Like, What are all these different levels?
So independent living, which might be senior living, they have kind of interchangeable names, is where older adults who are self-sufficient, they need a fewer household responsibilities, and so they are able to get just a little bit of assistance. And then when we get into assisted living, that's when people need help with their ADLs, which is their activities of daily living. And then they're also going to be more ingrained into activities and community. As we go on, there's the nursing homes or skilled nursing, which sometimes are used interchangeably, but sometimes not. But the idea is that the people are getting 24/7 care. And then they're also able to get skilled nursing for complex medical needs, so IVs and wound care and things like that. As we get into memory care, that's more dementia and Alzheimer's specific, as you would know. And then hospice is where we're at the end of retirement. We are focused on the comfort, hoping that could be done at home. But if not, then, at a hospital or at a facility, you're just taken into the care of people who have supported people to that transition many, many times before.
Down in Houston, where I was looking for places for my dad, we had this very nice man who was like a real estate broker. And he took me and my mom and my sister around to tour different facilities to help us find the right one that fit for us. Are there any equivalents like that here? I mean, it still wasn't easy, but having somebody to do the legwork really helped.
So for us with 50 Forward, we offer guidance, but we don't walk, and take people to the different locations. We keep our lists updated just because we do conservatorships also. And so that's something that we have to think about is when people's level of care changes, we have to do all the research of where are the beds open right now, what are the prices, and, do they cover laundry or not? Do they have the different levels of care right in a row where, we won't have to move them if they increase their level of care? There is also an amazing resource called A Place for Mom. And that's a website where you put in, what you're looking for. And then there are operators who do have a pulse also on what's available and all the things that I just mentioned.
What do you think are the most important things that people should be looking at or looking for when they visit potential future homes?
Location is going to be a big one. Is it going to be close enough to where their support system can visit and, keep them close? Of course, you're looking at the finances. And then the thing that I think is probably most important is the vibe. The feel. How do you feel when you walk in there? What is the staff like? How do they treat you right from the beginning? And then another thing that I always am interested in is the activities. And is the staff taking that seriously that, hey, as we get older, we need to have a lot of fun also and get those holistic needs met.
Something I'll say on the vibe front is that the people who will meet you at the front door also tend to be like real estate agents. Like they really super want you to move into their cool, fun community. And then you never see those people again. So my advice, something I learned was like, see if you can be there during a mealtime so that you can get that vibe from wherever the people in the community eat together. How does home health work if people are aging in place? Is that a viable option?
Yeah, it is. And it's the same as anything else with finding your budget level. With lower income, you can apply to the Choices program. That's through TenCare. As the income level increases, you might do private pay for your home care, and then you might have a long-term care plan of some sort that might have some coverage. Once again, you want to look around and find a home health company that fits for you. And that's another thing that we have lists, of that too, where it's updated rates that we can offer here at 50 Forward. We are here to help provide the information where you don't have to search, so much.
A fun fact about my dad is that he was the director of health insurance for the state of Tennessee employees. So he really knew the ins and outs of health insurance. But we then did learn that it's still, with that, very expensive. Now looking at my uncle who has none of that, we're looking at Medicare, Medicaid, and I'm curious how these can help with these expenses. And are there any other ways to get financial help?
This is a heartbreaking part of it, that there is just that gap where income inequality just comes right up. The big one really does go back to Choices, the actual program called Choices. That's going to be the best for people without the financial resources.
Speaking of finances, another thing that comes into play here is all kinds of documentation. People need to have a will, but even before that, before they reach the end of retirement, I learned the hard way that powers of attorney are incredibly important to have. How can people start down the road of ensuring that they have that documentation in process for the older adults that they're caring for?
Definitely working directly with an attorney is going to be the best route. 50 Forward, we do in our Madison location, we have an attorney who comes and offers free legal aid once a month. The next one's May 21st. And so that's a huge help. But I hear you on getting the power of attorney in place in advance. And while the person can be cognizant and, consent to having that signed and getting that in place. So I'm glad you can pass that wisdom on.
Will the attorney that you have come in there also be able to help people with wills?
Yeah, they can give some guidance to that. Yeah, to what next steps would be. Something we're becoming interested in is, it's called 5 Wishes. Have you heard of this?
I have heard of this.
So it's a document that it's a living will. And so it's about if you were to be alive and, be bedbound or to where you can't really speak up for yourself. And so it looks at that side of things too. So it could be all the way to, I do not want to be resuscitated, all the way to, yes, I would like you to put chapstick on me once a day. Yes, I like to sleep with my toes tucked in. And so that's something that I'm really excited about right now with 50 Forward, is trying to offer this as a service, because you can do it all the way from when you're 18 and on. So stay tuned with 50 Forward and 5 Wishes. I think that's going to bring a lot of value to people who take part in that.
Oh, absolutely.
I love, how holistic that is. I mean, people do know about living wills, DNRs, all that kind of stuff. And those can be hard conversations to have.
I tell my friends, do this now with your parents. I mean, it can be a really special moment, too, of celebrating life together, reminiscing, talking about memories, but then really to navigate end of life as the most respectful way possible. In order to do that, you have to have these difficult conversations.
And you're doing such a service to your family, because those are some of the hardest decisions to make. And as a child and a parent, you don't want to have that responsibility of making those toughest choices. It helps you live with what you decide, because you're respecting the wishes of the person you're caring for.
Exactly.
Jess, it occurs to me we'd never actually asked you what your job is at 50 Forward. What do you do there?
So I'm the director of care management, and we provide a few services. One is care management for people with lower income. And so it's kind of what we talked about, getting those home repairs. But we also help people sign up for SNAP benefits, LIHEAP, which helps with their energy bill. We help with home uplift and the weatherization program so that we can get people, once again, living at home as long as possible. We also help with TennCare, which is the Medicaid of Tennessee. We have a resource line that I would highly suggest. And me and the CEO, Sally, we wish that we had a vanity number, 1-800, but our resource line is 615-743-3416. People can call anytime. And so that's all just complimentary, grant funded for the public. And then we do have a more intensive care management where we can really look into, as we were talking about, the in-home care and kind of higher level of needs, where we can walk people through that process. And then we do the conservatorship program and really put the person first and do what's in their best interest. And we want to make their finances last as long as possible and make sure that they're getting the level of care that they need, and check in and keep families involved in a healthy way. And when it's not healthy, to be able to insulate the person from those kinds of abuses.
Well, so I'm sorry, but we're going to have to address the elephant in the room. The Trump administration seems to be threatening all sorts of cuts to not just Medicaid, but Social Security too. Obviously, we have no idea what's going to happen. But what advice are you giving the communities you work with about this?
The biggest right now is take it step by step. There's a lot of fear, and clearly things are in flux and look like they're going in a really scary direction for all these benefits for people with lower income or on retirement. I would say also creating your Social Security online account would be a good thing to do also, because you can do a lot of the things that you could do in a field office, you can do online. Also, just know that the phone line is still open, the offices are still open. And so in the Nashville area, kind of business as usual right now, but to prepare, get that ssa.gov account going, find support if you don't know how to do it. And then if you do these phone calls, just know that it's going to be hours and hours. When you finally get on the phone with them, there very well could be disappointing news that comes, but also make room for good surprises, because I've sat with people who had just been kind of pushed aside for a long time, and then all of a sudden the good news did come, and it was just such a relief. So
that is a great attitude. We are back with Jess Quasi from 50 Forward, and we're going to talk, about technology. That's a huge challenge for older people. If you've got a relative or loved one who is completely computer illiterate, or they don't even have a smartphone, can 50 Forward help get them up to speed?
Absolutely. Yes, all of our locations offer tech literacy classes, and then there's also the library offers some great tech literacy classes.
A big thing I worry about with my mom is phone or text scams. Frankly, my mother has been known to click on the pop-up ad that's like, your computer has a virus. And then she gets on the phone with somebody and then they're like, well, what's your IP address? Luckily, I have my mother now, very well trained. Hi, Mom. I love you so much. What's your advice for helping folks navigate the possibility of scams and what to look out for?
Yeah. I mean, first and foremost, don't give out Social Security numbers and credit card numbers, banking information, passwords over the phone. No one should be calling and asking you. If you have any inkling that this could be a scam, then call directly. If they say they're Medicare, okay, great. Thank you for calling. Hang up on them and call Medicare and try to talk about the thing. That's going to be a big one. And just know that these scammers use urgency and threats to push you around, and that's not what Social Security would be doing. And if Social Security called you, what a world that would be. Wouldn't that be, that's too good to be true. And it can happen to anyone. It did happen to my grandma, but it's also happened to other people that I know that are younger, and just erring on the side of caution. And if you have any question about it, maybe run it by, a family member or a friend, or call the place directly.
What if you have a relative who's still active, but maybe they're struggling to find community? What's your advice for getting them out there, finding new friends or hobbies?
For community and support, please come to one of our 50 Forward centers. It's membership based and it's super affordable, and we work with all income levels. And so there are all kinds of classes, all the way from a hand chime choir to chair yoga and Tai Chi. And can I just say hand chime choir one more time?
No, that's so cool.
Cool is that? And so, yeah, definitely hooking in with one of the centers. There is just such camaraderie and friendships that you can build over the course of years and decades, which I will say, come next year, 70 years of 50 Forward.
Wow.
Yeah, founded in 1956 and still going strong. Then you can go to the website 50forward.org and see about that.
That kind of leads into this next question, though, that I think Marie and I have is like, what if you have a relative who says, I don't need to go out and meet anybody or do anything? Like, what should our role be in a way to be useful but not overbearing?
Oh, that can be so hard when you see so clearly that something could benefit someone and then they don't want to do it. And there is not much we can do when someone's an adult and, not wanting to take those steps. But what we could do, even if we're, have a distance between us, whenever we do get out there to spend time with them, go do those fun things together. It all comes back to what can we control and not. If someone's not willing or not wanting to get out and you don't want to be overbearing, another thing is to just keep offering ideas to them in our care management. If we do assessments with someone, which we do for every person that comes in, and we see that there's a low support system, we offer, hey, 50 Forward has all of these things. And sometimes the person's saying, no, not interested. But then as we talk more and build that trust, our care manager brings a calendar of here's all this cool stuff we do. And they're like, I love hand chimes. And it's like, oh my gosh. And so I think just, continuing to set the table there for people to come and, be nourished holistically like we were talking about.
How can we make sure to have healthy boundaries? I'm talking for myself. My uncle told me yesterday he hasn't had a shower in 3 weeks. So I'm like, should I get in the car, drive down to Atlanta and make sure he bathes? Like, how do I protect my own mental health as the caregiver?
Yeah, really knowing what you can offer and not. And, it's not in all of our cards to be able to hop in the car, and do that. And so if what you can offer is a phone call and encouragement, then that is enough. That really is enough.
I obviously don't live close to my folks there in Houston, but we've been fortunate enough to cultivate an amazing group of friends and neighbors around them. And I have those people's phone numbers. So I can actually check in on my mom or dad without them even really knowing I'm doing it. That gives me a little bit of peace of mind. And I think about that too here in Nashville. Even if you don't have an older relative, you probably have an older neighbor. I highly suggest checking in on them from time to time. If it looks like their grass is too tall and they're going to get a codes violation and you have time to go mow it, like these are the little things we can do to take care of our communities.
What other support systems are there in Nashville for caregivers? I know that for Alzheimer's, we went to several support groups.
Yeah, one that's coming up is it's called the GUIDE program. And this is for people who are caregivers that are taking care of someone with dementia or Alzheimer's. And you get a stipend per year to cover some respite care so you can go take care of yourself and make sure that they're safe. And so that money can be used, I believe, for having a caregiver come into the home or for them to go to something like an adult day service. You could call us. Once again, it is 615-743-3416.
Amazing.
Yeah.
Jess, this has been so great, and it's wonderful to know that y'all are there. I have personally taken note of the fact that the name of your organization is 50 Forward, and so I'll be seeing you in late July as I round that corner and I need to be in a hand chime choir.
Yes, we'll see you there.
I'm coming your way.
Oh, that sounds so great.
But yeah, we're so grateful.
Yes, thank you, Jess. This has really been wonderful talking with you.
Oh,
Thank you.
I'm so glad to be here. It's nice to talk to people who are helping and care and who have, walked your own loved ones through and, that we could just connect on all of this. Really appreciate you all.
That's all for today here on CityCast Nashville. If you enjoyed the show, why not tell your friends? Rate the show, leave us a review, and subscribe to our Hey Nashville newsletter. We'll be back tomorrow morning with more news from around the city. Toodles!